Good evening and welcome to Sweet Beginnings. Thank you for joining us tonight. We're delighted to share with you that we have over 500 of you joining us tonight. And I'm really excited, and I've learned that, there's folks that are joining us here tonight as far away as New Hamburg. I've heard that once the New Hamburgians figured out this Zoom stuff or whatever, they actually haven't left their village ever since. But we actually do have someone joining us here tonight that's traveled actually a really far distance. She flew in all the way from Calgary last night. And it's actually Jess's older sister, Tracy, which tells me two things. That Tracy really loves her younger sister, and that Calgarians might not be as sharp as New Hamburgians and have not figured out that she could have just come to this event virtually. But here we are. Now, before you get on Twitter and start going and saying at JR Bondi and at John Neufeld 98 at Hoff Watt, REG, are not socially distanced enough, please know there's plexiglass here between us, so we're like two sports commentators tonight with you. So we've got that all out of the way. I hope you're comfortable. You've got your dessert there. Thank you for joining us for the next half hour tonight. We want to say a heartfelt thank you to the sponsors that this evening would not have been possible with. Their support, the faithful support, has been given to us for many years. The Transform sponsor is RBJ Schlegel. Our Inspire sponsors are Urban Good Funeral Home, Hurley's Family Market, Lease Pet Distributing, and Kindred Credit Union. Our Hope sponsors are Jocelyn Insurance, Joe Reinhardt Glass, and Henry Walzer Funeral Home. Thank you to each of them for making this evening possible. Before we get into Sweet Beginnings that you have made possible for us at House of Friendship, our team at House of Friendship wanted to share two very important statements. As we begin our evening, we want to acknowledge with gratitude the land we are on in Waterloo Region. Our House of Friendship programs are situated on Haudenosaunee Confederacy Treaty Land, the traditional land of the Haudenosaunee, the Anishinaabe, the Attawandaran, or neutral people. This land acknowledgement is just a small part of the Truth and Reconciliation calls to action, where we are called to learn the history of our local urban Indigenous community members, listen to their stories, and use our power to make change. A treaty is an inheritance, a responsibility, and a relationship. May we be good neighbors to one another, good stewards to our planet, and good ancestors to all of our children. Also, our team wants to acknowledge the racial inequity and systemic oppression ever present in our community that further perpetuates poverty, addiction, and isolation, and impacts the individuals we serve every day. May we come together as a community to honor, listen to, and prioritize the voices and ideas of racialized community members. Thank you. We're so glad each of you have joined us. We're celebrating some sweet beginnings together thanks to your support in all four areas we serve in: addiction services, food, neighborhoods, and housing. Throughout our time together tonight, team members will be responding to as many conversations in the live stream chat as possible. So feel free to leave your comments, questions, good wishes, comments on our outfits. Any people from New Hamburg who were upset about my comments and want to rebut them, it's your time, it's your moment. So let's begin with the beginnings are so much sweeter when they are long awaited and anticipated, like our addiction treatment center in Cambridge. What began 4 years ago as a dream of a more dignified place our loved ones could go to for help became a journey of unexpected twists and turns. From adding another floor midway through due to the growing need, to an online petition, to a devastating fire, and then a pandemic, with your encouragement and support, we stayed committed to building this new treatment center that will now serve our region and loved ones for decades to come. With great anticipation and excitement, At last, we moved in on August 24th. This was indeed a sweet beginning this year. In our food area, COVID required we find new ways to share food. In the first 25 weeks of COVID, we shared 500,000 pounds of food in places like parking lots to keep everyone safe. We met folks online with cooking and social programs to keep them connected. Hundreds of phone calls were made so that people knew that they could still get food. We added food delivery for those who couldn't get out to ensure no one was left behind. Now that the back-to-school season has started and we continue to support families with things like healthy snacks, connecting with youth and parents, and stepping into gaps that COVID has created in the supports available to these families. The same pivoting has happened in services in our neighborhood services, where we continue to support families living on low income. We just had to do it virtually now. The team embraced new ways of doing things, like running a successful youth cooking program that helped these youth connect with their parents and learn new skills together, and embracing all sorts of new messaging platforms so that our family outreach workers could continue to communicate and support these families during this time. And lastly, in housing, at this time in the sweet beginning, it's probably the one you've heard the most about, and that's shelter care. This time, I'm just going to cue the video for you to learn a bit more.
I've been homeless a long time. I thought I knew what shelter was like. A place to sleep in a crowded room with 3 other guys, no privacy. Being woke up early after not really sleeping, fighting for a spot in the bathroom, breakfast, and then out on the street. Another day of survival. But that's not what it's like today. They have a new way of doing things. The shelter moved to a place where I could stay 24 hours a day. I had help to find housing right down the hall. When I needed to get my blood sugar checked, I could have a nurse help me out. I could stay healthy here. I'm also getting help to stop using so much. I'm seeing an addiction counselor, and who knows, maybe one day I'll head to treatment. I'm excited about getting a place of my own. My kids will be proud that I'm back on my feet and feeling a bit more like me.
This new way of doing things is called shelter care. By having health care and shelter in the same place, lives are being transformed. Overdoses have been reduced by 50%. Emergency medical service calls have been reduced by 75%. And 56 men have been housed in the last 6 months. The shelter care model is working, and lives are better because of it. There's no going back. Join us at www.sheltercare.ca to read stories of new beginnings and learn how you can ensure shelter care continues.
Welcome back. So here tonight, I'm honored to have Jess Bondi here, our housing director, who leads the housing team, the shelter team, and has been a key instrumental part of this shelter care piece that we've worked on. Jess, tonight I want to ask you 3 questions. First, what's happened over the last 7 months? What have we learned? And where are we going? So let's start with the first question. For those who maybe haven't been tuned in or haven't maybe read the news and that, take us back to March when this all started.
Well, first of all, I have to say, John, your shirt is very fancy.
Well, thank you.
John's rocking our shelter care shirt. Shelter care is rad. So we got those for all of our participants and all of our staff and partners who were helping us at the Radisson. So you asked the question, take us back to March. So, you know, take a moment, reflect on March. That's when school shut down. It's when we were told to only take essential trips to the grocery store. It's when grandparents were told that they couldn't hug their grandkids. You know, that is what we remember about March. For us in the shelter system, we realized that we had to panic productively. So that's exactly what we did. We had 2 individuals in our shelter who were struggling with symptoms of COVID-19. And very quickly, we realized that we had to solve that problem. It wasn't working well. John and I were on a call, and very quickly an email came through from our friends at the Radisson Hotel saying, how can we help? And within 24 hours, we had redirected city buses. We had taken our 51 men from our shelter, and we had transitioned them all the way to our new location at the Radisson Hotel. Now, the Radisson was incredible because it gave us the chance to support our shelter participants 24/7. They could create their own schedule and create their own routine. We were able to very quickly reutilize resources within the system and in the community and bring them right on site. So our participants had access to housing whenever they wanted. They had access to connect with our primary care clinic and get a prescription sorted for them, or connect about maybe their blood pressure. They had the opportunity to get naloxone right on site as well. And those are some of the things that we've realized as a result of moving to this new way of doing things, is that we provided people, our participants, the chance to choose. And we made it easy for them because we had all of the services and supports that they needed right on site. And I think the 24/7 access, so folks weren't carrying their belongings around with them all day or fighting for a bed, as you heard in our video, that means something. The partners and the services on site, that means something. And then the other big piece that's been so successful is the relationships. We engage in this work by connecting, by supporting people. And those 3 things, along with the healthcare, has been so essential in making the shelter care dream come to life.
Jess, what's interesting about what you were saying is during COVID, there's been conversation about hotels are now the answer to homelessness, and I think that's actually very inaccurate. I think hotels are super helpful in the sense that they provide a more dignified environment. There's more space, people have a bit more privacy, but it's not the answer. I always think of, you and I have talked about the broken leg, and if I break my leg really badly and I go to the emergency department and I'm laying there and doctor comes, looks at it and says, oh, that's really, really badly broken. You're going to need surgery, but that's going to take 3 or 4 years. But in the meantime, you know what? You can rest here on this bed. We'll give you a meal, and then we'll see you in 3 or 4 years. And I know that sounds so ludicrous, but that's essentially what we've been doing to address homelessness. We've been essentially warehousing people and providing a mat and a meal, and then wondering, why are they not getting better? And why years later can they not even walk on their leg anymore? Or why are they in worse shape than they were before? And so I think the key point to remember here is that we didn't just move into a hotel, is that we integrated with healthcare and all these necessary other services for this population. That is absolutely critical. So Jess, what have we learned from the last 7 months?
So, we have learned a lot through this shelter care dream coming to life. And there's some big numbers. Some of the numbers were mentioned in the video. 75% decrease in the number of our participants who are making their way to emerge. That is incredible. 0 people in our shelter system have experienced COVID-19. Incredible. And another key stat for me is the number of people that we've been able to house. 56. We've housed 56 men in our community as a result of COVID-19 and the shelter care model. And to me, that's incredible. The folks we serve are navigating really complex life issues. About 80% of them require either addiction and/or mental health supports. About 75% have an undiagnosed or diagnosed acquired brain injury. And almost all of the men we've served and serve struggle with childhood trauma and difficult situations that they've navigated throughout their life. The folks that we serve need us. And we've been able to see incredible results. One of the results I wanted to share is also our police stats. So what we've noticed, as you can see here, that we're relying less on our police services. So the bars that you'll see here in blue are at our old shelter. So you'll see those lines, to the far right. And that's how often we had police on site. And the orange line that you see is the new shelter at the Radisson location. And a point I want to make is that at the Radisson, we also doubled the number of people we served. So there are 100 people that we're serving, and we're seeing this decrease in police services stats. That is incredible. It's absolutely remarkable. And the big numbers do matter. They make a difference. They create validity for the work that we're doing through the shelter care model. But there's something more. It's what we are hearing and what we are seeing and what we're experiencing. So our shelter staff, they are the champions for our participants. They care so much, and they pick our participants up when they're down. But what we've been able to see through this model is that our shelter participants have hope, that they are excited about their future, and that they realize that they can do it. And, that is life-changing. The fact that through this model, we've been able to ease up a little bit for those participants, that we've been able to create that mind shift and help them believe that, the future is bright and that good things are going to come to them. That is absolutely incredible. And, that is one of the key pieces that we have seen day in and day out with our participants that we're serving. And I think it's that attitude and those changes that we've been able to do that really do make it so that once we house people, they stay housed. Of the 56, not a single one have come back to the shelter system. And I think that's indicative of the fact that, we've set people up for success. They know who they can go to if they need help or supports. And previously, we would always have folks coming back to us at the shelter. They'd move in and maybe their housing lasted 1, maybe 2 months, and they would always come back to us. We're not seeing that. And, as a housing provider, we know that housing is how we move the needle on homelessness in our community. And the shelter care model has been so successful in doing that.
So I want to pick up on that number, the 56, which is a record amount for us in that time period. And the fact that your team was able to do that, in partnership with our community partners during COVID is a whole nother piece. But Jess, you and I talked about that 56 didn't all go to supportive housing. Some went to market rent, some went to live in market rent with subsidy, which got me thinking, as you and I were sharing the shelter care model with some of our friends at a provincial level, there was a doctor there, a psychiatrist, who was listening to this, and he said, if we think about this in a different context, anyone that would go to their doctor's office and would say, hey, I have a sore back, no doctor would just immediately refer them for back surgery. Right. We would do an assessment. We would then maybe send someone to physio. We would get them to do exercises. And then maybe out of 100 people, maybe 10 would actually still need back surgery, but not all 100. And I think that's really pertinent for ours, because in the old model where, shelter is basically warehousing, a mat and a meal, everyone comes through, they've got broken legs, they've got such severe mental health, such severe addictions, that we just assume that they're going to need really intensive housing. Yep. But what I'm hearing and what I've observed over the last 7 months and what I've learned, I think, is that housing is the answer to homelessness, absolutely. And shelter care, when done properly, can be like that triage, can be like that place where as soon as someone comes into homelessness, we can do an assessment, we can address their physical health, their mental health, their addictions, and almost like a triage in a hospital. We would never let people just randomly walk around in a hospital and pick a room or wherever they'd want to go and what floor they'd like to be on and get that treatment. They go through triage, and I feel like that's what shelter care is able to do for individuals. And so I'm not surprised that the numbers, at this time is still 0 of people who've returned, with unsuccessful housing. So I'm really excited about that, and seeing this as a potentially really great way to make housing first in our community move forward in a more effective and an efficient way. So Jess, we've heard what's happened. We've learned lots of things. We still have lots to learn. where are we going next? What's happening in this community and with shelter care?
John, you're bang on, right? We are learning so much every single day through this shelter care concept. You know, every day we are problem solving and trying new ways of doing things. And it's incredible that in our community we have the opportunity to do that. You know, just about 2 weeks ago, we just moved to our new location. So we moved to the tower at the Inn of Waterloo. And here we'll be able to set in some roots and dig in a little bit further into this wonderful work of shelter care. So we know that in the early days that the primary care and the health care and the harm reduction supports, and that those things were so essential in getting people housed in our community. What we're continuing to see is that as more and more people and organizations hear about this great work, there are so many more partners who are coming to the table, and that is ultimately benefiting, you know, our participants and the folks that we serve. You know, as John said, you know, shelter care is really helping to navigate the housing system. And because we have such long wait lists in our community for supportive or affordable or community housing, you know, shelter care is that time where we can use the shelter experience to build capacity, to build confidence, and to build skill. And that's what we're seeing. You know, our frontline shelter staff are able to really engage and connect with participants. They're able to have those coachable moments of, you know, maybe that wasn't a great choice or decision, and what might you do next time? You know, those reminders and prompts that help build capacity for our participants and help empower them. And so that's one of the really cool things that we've been able to do as we learn about the shelter care model, is we're shifting our approach in shelter as well. You know, every single one of our shelter workers are now trained in engaging in housing plan conversations. And that's another way we've leveled up, right? We want to make sure that we are continuing to engage and promote housing. That is really what we are looking to do in this model. You know, some of the other things when we think about the future of shelter care and where we're going, you know, there are so many other shelters across, you know, the country and across the province who are curious about this model. And we've been able to connect with them. We've been able to share some of the early successes and our wins, provide some, you know, tips, recommendations, whatever it might be. But it's still early days. We feel like we've got something here. You know, this is a model that is working in our community. It is a dignified shelter environment, and it's creating incredible outcomes, not just for our systems and the other systems that we touch, but for our participants. You know, and so, you know, we ought to continue to bring shelter care to life in any way we can and in a variety of different communities, because it is truly making a big impact.
I think you said it best, or it said in that first video, there's no going back, Jess. Yeah. You know what I've loved about the shelter care model is I've watched our community come together and do this model together. Is what I love about it, it's not rocket science. It's just simply integrating shelter and healthcare and other related services. It's a simple concept. It's one that can be done anywhere across this province, across this country, and that's, I think, what we genuinely want to see. We want to see a new way for individuals experiencing homelessness to a new way to experience better health and better outcomes for themselves. You know, as Jess mentioned, we're engaging our elected officials. We're talking at a provincial level to try to influence those kind of conversations, meeting with, you know, friends at Ontario Health and the Mental Health and Addiction Center, and trying to keep those kinds of things moving forward. But just as we try to move systems and work with our partners at the region and others, let's talk about the individuals, you know, our community partners who've been on the ground, who are there in the hotel every day, you know, our shelter workers who are there on the ground with the individuals. How are they feeling about all this? Mm-hmm.
Yeah, our shelter team and our partners, I don't have enough words to say my gratitude and my appreciation and my thanks for them. You know, these folks in these pictures, they're heroes on the front line. They're folks that just jumped in to a new way of doing things, to problem solving every single day, believing that this could work and would work. And it's been absolutely incredible to get to work alongside so many people to bring this dream to life. It truly is incredible, and I have so much appreciation for our team and our partners who are doing this work. One of the things that really inspires the folks who are making this come to life is you, our community. It's folks like you who are rallying around them. I think for far too long, folks who worked in this field didn't feel like they were heard. They felt left behind or forgotten. And what we've heard through this national conversation and the coverage that we're getting around this model is that Waterloo Region has our back. That they aren't out there alone, that they are supported and being cheered on from the sidelines. And we are so thankful to you, our donors and our community members and folks who are just so excited about this new innovative way of doing things. So thank you. For our shelter team and our partners though, what they really got into this work to do is to make a difference. And I think that that's really their why. They really want to empower and support people who are struggling with homelessness and such complex health. And so when you think about the why, there are so many incredible success stories that we've had through shelter care. We've talked about a few of them tonight with respect to the housing and the outcomes there, the decrease in overdoses, all of those are incredible successes. But those data points don't really share the story. So I wanted to share with you one of our participants. Roy bravely is going to share his story about the impact of the shelter care model and the difference that it's made in his life.
My name is Roy, and I have been homeless for almost a year, or maybe a little over a year. I was working, but for health reasons, I lost my job, and I couldn't afford my rent where I was living. I wasn't sure what to do. It was overwhelming. I didn't contact people to get help. I did not even contact my relatives for help. Maybe because of my pride. I was always a fighter. When I say a fighter, I mean I always liked or tried to be independent and to be a bit proud of whatever I'm doing. At least to let my family know that I'm worth something. My last resort was to go to House of Friendship. It was a relief to know at least I have a shelter, I have a bed, and I made friends. And I could able to say, you know what, this will one day end. And I was so thankful. I had a roof, and I took care of myself, and they took care of me. And I respect them, and they respected me. Looking back to where I was, it was darkness. I feel that there was no hope, but I kept walking, and I came to a situation in life where, with the help of the community, I am now in the light. If there was no support from the community and the region, after I had been evicted, what would I have done? Go sleep in Victoria Park? Freeze to death? If it wasn't for House of Friendship, I could have been dead. It wasn't a good journey. It was a rough walk, a rough talk. But by the grace of God, and people like you all, today I am better. And I thank you.
I want to say a heartfelt thank you to Roy for sharing that story and that journey. Yeah, hard to follow that. So as we end tonight, for those of you who are interested in supporting shelter care or individuals like Roy, please know that you can donate. There's a link at the top of the chat or at the URL on the screen below. We're also going to make both Roy's video and the shelter care video available immediately right now. So on social media, for those of you if you want to share, I hope the conversation can continue as we end this evening, and I'm dying to dive into my favorite rhubarb pie. Thank you to our friend Tim for baking it. And as you go into dessert, I hope this conversation doesn't end here, that you continue to ask questions about how we address homelessness here in Waterloo Region, and maybe as a province and maybe as a nation, that this conversation continues from here, and we've given you some things to talk about. On Monday, we will be sending you an email with the video recording of this so you can share it with others. And if you didn't register for tonight's event but you want the email with this video, please email Don Gill at specialevents@houseoffriendship.org, and we'll make sure it comes your way. Again, a heartfelt thank you to each of you on a Saturday night for joining us, for making the sweet beginnings that we've shared with you happen this year. A heartfelt thank you. I hope you have enjoyed your dessert, or if you still haven't, please join us. Have a great night. Thank you again.